So the IDEAS program, which is basically based around multidisciplinary working or interdisciplinary working, is a very comprehensive program that's been set up. And essentially what it does, it demonstrates how to do stuff, and you learn the focus of aortic work, and vascular disease. But what it also does is it has got representation for both vascular and interventional radiology, and it demonstrates how team working is actually the way forward and how working together the patients can have the best outcome. And it's all very well us saying it in theory, but the IDEAS program actually demonstrates this. And across Europe, there are multiple examples of how this is a really good thing. So working together is the best for the patient, really, and IDEAS represents that. EVAR is an integrated part of the AAA or abdominal aortic aneurysm treatment pathway. And with the advance of the NICE guidelines and such, it is still very much part of our daily routine and weekly routine. And knowing the basics of an EVAR is actually a transferable skill. So once you learn how to do an EVAR, you can transfer that to other stent programs. And then it's the next step will be to do sort of fenestrated and more complicated work or complex cases. And I think it's really important that we understand the basics of it. And this session will be divided into two sections. My colleague, Dr. Qutbi, will be covering on the how to measure, how to decide who's suitable and who isn't. And then I will talk about the more complex side of EVAR and how to sort of get out of complications and intraoperative issues. I think attending this session will be very interesting because it'll be a sort of some presentation with some case-based focus of discussion between me and Dr. Qutbi and the moderators. I think it'll be very good because you'll see different perspectives of how EVAR is done and how many things we do the same and how we do things differently. So I think whenever I've attended these sessions, even as a teacher or moderator, I've always walked away learning something new. And whatever you learn in these sessions, as I said, are transferable, so you can actually apply them to other situations where you will have challenges, and things we'll cover such as difficult access, tortuous arteries, and things like that, which we will deal with even outside of the EVAR. By the end of this workshop, the participants can expect to learn how to, in theory, do an EVAR from start to finish. They will know how to identify them during their multidisciplinary meetings and maybe even sort of have input, especially for junior doctors who are attending vascular meetings, to actually have discussions about how to manage complex cases and how to plan for them. So by the time the procedure starts, everything's already done theoretically. So it'll be a very good session to walk away from, learning how to plan a case and how to plan for every eventuality, going into an operation prepared. Well, the IDEAS program, as well as CERSI, the program this year is very, very good. But I like the fact that there's a lot of on-demand setups for CERSI this year. So whenever I've got sort of patients who I can't book a session off, I can actually come back in and actually look at whatever I want on demand. So I'm actually very much looking forward to that. And that's something that we didn't have during the live meeting.